All right. So my name is David Walton. I am the event and program manager with the Tompkins Chamber of Commerce. And we are really excited to have you join us today, like I said, for our first Learn workshop of 2021. Would like to give a huge thank you and shout out to our Learn series sponsor, Tompkins Trust Company. Last year, we did have 35, 40 of these Learn workshops to share a lot of information about things that you needed to know about what was going on in the community with COVID and beyond. And today we are excited to hear from some experts as they share facts regarding the COVID-19 vaccine progress here in Tompkins County and what you as an employer or an employee should know to support your workforce by becoming vaccinated, what best practices to use, and what other New York State regulations are required of you. I will say that during our presentation today, for optimal viewing experience, please feel free to shift the way that you can view the Zoom, where you can shift from Brady Bunch mode to speaker view, so you can see each panelist individually. But I know that we're all certified Zoom experts by now, and I'm sure that you're already privy to that. So without further ado, I will go ahead and turn things over to Chamber President, Ms. Jennifer Tavares, to do the introductions of all of our panelists today.
Thank you so much, David, and thanks everyone for being here. We have been wanting to bring some information to our members in the business community for some time about vaccines. Things have been changing rapidly. I don't know that everyone has an opportunity to pay as close attention as some of us might be to both what's going on in Tompkins County and at the regional level, at the state level and national level related to vaccination distribution. It's you know, almost daily now that there's been some shifting regarding eligibility, regarding who's able to give vaccines to which populations. And so while not all of that is necessarily information that every employer needs to have, the goal today is really to help you understand a bit more what your role as an employer might be, how you can encourage broad adoption of vaccines within our workforce in Tompkins County. Obviously, part of our motivation and goal is because we want to see both from a public health perspective, but also from an economic perspective, as strong of a recovery from COVID-19 as we possibly can. So to do that, that's going to take all of us. It's going to take people understanding what their roles are and also what they could do to perhaps encourage more widespread adoption of and receipt of vaccines by our workforce and our local residents as quickly as possible. And then, of course, we never wanting to accidentally say the wrong thing, have invited a legal expert to share, you know, what his perspective would be on anything from the state and federal level that you need to know as well. So really briefly, before we move on, I just want to commend I'm on the Regional Vaccine Task Force, as several people here are. I do have access to a lot of information, and I have just been so impressed with the job that our partners in Tompkins County, at the Tompkins County Health Department and our Tompkins County Administration, and our partners at Cayuga Health System, Cayuga Medical Center. They have done an absolutely incredible job of setting up our vaccination systems in Tompkins County, of working to distribute in as timely a fashion as possible a significant amount of the regional vaccine supply. And also just are, I think, doing an incredible job trying to access and support our vulnerable residents and populations as well. So just, you know, can't say enough about what's going on there. Just a quick fact for everyone. As of today, over 20% of the region in the southern tier has received their first shot, and over 10% has received their second dose of vaccine, which is really pretty incredible. And so the supply has changed drastically in the last 10 weeks. It's going to continue to change. I don't want to steal anyone else's thunder, but I just wanted to really share some, congratulatory words with those of the folks here and certainly their extended teams for doing such a wonderful job getting these vaccinations out the door. And so without further ado, I would like to introduce Amie Hendrix. She is Deputy County Administrator. She is core to our efforts in Tompkins County to combat COVID-19 at every level from the beginning of this challenge. She really has played a critical part and will continue to moving forward. And I'm excited to hear what you want to share with this group today, Amie. Turn it over to you.
All right. Well, thank you for having me, everyone. And I'm going to go ahead and share my screen with some great stuff that Dominic Recchio, our communications director, has provided for us. So as Jennifer mentioned, I'm the Deputy County Administrator here, and a full year ago and a few days, I was reassigned to managing the COVID response. At that time, we didn't really know what that fully meant, but I was provided the pandemic plan that we had crafted and said, you're going to need to work out of the health department for a little while we figure this thing out. It was soon after that we started partnering with Cayuga Health Systems, as well as many community partners, to think through all of the things COVID related. And I will say that as we get into vaccine and the vaccine rollout, that's continued to be the case. The reason that we have been as successful as we have, and I really do think we've been very successful, is because we have key community partners that are willing to stand up and step up to do a lot of things. And that includes setting up, a mass test site, as well as a mass vaccination site, as well as, providing staff and resources, providing networks when we started going different places, and making sure that we can really get it out there. So none of this would really be possible without all of those teams. So let's talk a little bit about vaccine and what's happening locally. The first piece that I do want to point out is how we've moved to what we call the vaccine registry here in Tompkins County. So about 2 weeks ago now, we launched the COVID vaccine registry, and here's the link on here, and we'll make sure that you have all of that available if you haven't used that. And what we've asked people to do is, if they're eligible, they register on the vaccine registry. And all employees should be signing up on that registry. And this allows us to do a few things. One thing it allows us to do is communicate directly with the individual who's searching for vaccine. So if vaccine's available locally through our mass site at the mall or through other places, we're able to let them know that there's local vaccine being distributed. We also provide them registration links through the site. It also allows us to understand what the dynamic is and how many people we're looking at in any one category. It allows us to really look at the data and understand who we're getting vaccine to. Here in Tompkins County, as I've mentioned, we have that partnership with Cayuga Health Systems, and we have stood up a large scale site, which has allowed us to really push a lot of vaccine through one place. And we're bringing a lot of people to that one place. That's included bringing seniors there from some of our senior housing communities, as well as starting to think about how do we go out in the community as well. So it's not the only tool that we have, but it's one key tool to what we're using right now. As we start to see more groups that are eligible, we'll look at that and see how we can continue to reach those groups and what's the best way to do that. And so I really do encourage everyone here to please, if you haven't looked at the registry, even if you're not eligible yet, you can go ahead and look into it and see who is eligible and understand what's in that registry, as well as encouraging your employees to do that. In the beginning of this, we were communicating directly with employers as their categories became eligible, and then the employers would provide the links to the employees. It gets more challenging when you have more businesses. So when bars and restaurants opened up, that's a much larger and broader category, which we may not have all of the people that are running that as quickly and as accessible as we do through the registry. The other piece to the registry is for people who do not have emails, they can call 211, another great partnership, and 211 provides the registration and gets them into the registry. And then if they don't have access to a computer to actually register, we've partnered with 211 as well as our Office for Aging to make those calls and register people when we have vaccine available. So the next piece is a little bit about who these people are behind the scenes. Our county workforce, we are also an employer of over 700 employees in 27 departments doing 27 different things. What are we doing as an employer to help our employees take the vaccine? One of the first things we did is we offered leave time. When our employees are eligible, they're provided, I believe, up to 4 hours per appointment to go ahead and take leave. It does not include if there were some kind of sickness or something as a result of that. We have had discussions about that, but at this time we're providing that 8 hours along with other fringe benefit time. We're also sharing all of the information on eligibility directly to our departments. It's been nearly a year. We have done weekly town halls with all of our staff via Zoom, as well as YouTube, and saving those for future for all of our staff, where we talk about eligibility. We also talk about why we need to have a vaccinated population. Why is that important? Often Frank Kruppel will join us, and it's held, usually it's myself, the county administrator, and the other deputy county administrator, but Frank often joins us to talk with our employees about what's happening. The other big piece to all of this is we are continuing to push out messaging about mask wearing, density reduction, and distancing. And we've provided directives, which are on our human resources website, that clearly outlines what we're asking our employees to do. As people are getting vaccinated, there's a lot of discussion about what changes when you get vaccinated. And we're actually working with, it's nice that Dr. K is here. Dr. K is on this slide, Dr. Klaypak. We're working with him to start talking about, so what changes and how do we start creating messaging around that? So that's kind of the next piece of all of this, is what does change? And that's where we get into some of these current unknowns. One of the pieces is our vaccines were passed under emergency use authorization, which does not mean that they are not effective or safe or less effective or less safe if they were not. However, it does have some really interesting pieces about if we could mandate it and what that impact is. And I'm not even going to touch on what that is because Jordan's on here and I'm sure he can touch a little bit more broadly about what that looks like. But at this time, it does create some barriers and some challenges, and a reason why we haven't been able to mandate this if that were a direction that a business would go in. And then this is the really interesting piece. As with everything COVID, things change quickly. So yesterday, we finally received from the Department of Health new travel guidance regarding people who are vaccinated. Fully vaccinated individuals do no longer need to quarantine when they arrive in New York State 2 weeks after their full vaccination. That lasts for up to 90 days after the full vaccination. And then mask mandates and distancing are still in place. There was also guidance about vaccination and quarantine that was released yesterday. And then I think at about 10 or 11 this morning, the governor also made an announcement stating that as of April 1st, there will no longer be travel restrictions for domestic travel. So that's for people who are not vaccinated as well. There is not guidance on that. That was a press release that the governor put out today. So these things are shifting quickly. This travel guidance comes from CDC guidance that the state adopted. The new lifting of the restriction and whatever guidance may come is forthcoming. I don't know all of the details around it. I do know that that goes into effect April 1st, and we're still waiting to find out what that is. Another big piece to all of this is in our community work is addressing the hesitancy and skepticism. So as employers, you will probably hear a lot of this. There's a lot of concern, and we've seen this as different eligible groups have been vaccinated. People are concerned about what could happen. Will they grow a third arm? Those kinds of questions, all the way to, let's just see what happens with the other people. We've also seen some vaccine shopping at this point, hopefully not a ton, where people would prefer to have the 1 dose Johnson & Johnson, or they've heard that Pfizer second dose may be different than the Moderna second dose. So this is what we have done to address that. We've provided office hours. There's virtual office hours with local doctors. There's 8 events available on a Tompkins County YouTube channel. There's many different sessions there. Patricia actually helped us create the session in Spanish. And what we've done is really allowed people to discuss what their concerns are. and discuss that with a doctor that they can feel comfortable, or medical staff that they can feel comfortable with. We're going to continue to push a lot of this because we know at this point there is limited supply of vaccine, and there are a lot of people that want to take the vaccine. At some point, we're going to hit that tipping point where it's no longer about the supply of vaccine coming into our community. It's more about getting people to take the vaccine. And then I think the final piece to this is, while we are getting vaccine in, and I think today was an 1,100 dose day for our first dose clinic. So we're getting vaccine in at a pretty consistent basis. And we're showing that we can get it out. We're not wasting vaccine, we're getting it into people's arms. We still need to be very vigilant in our community and understand that there's still a need for testing and monitoring for the symptoms, making sure that we understand that while people are vaccinated, there's still a lot of people who are not, and we have to follow all of those same precautions. And there's still a lot more to be learned about this whole pandemic and how we work together. So that's a message that we'll continue to push. I know that our public information officers are working on kind of revamping some of the posters that all of you have. And thank you to all of you that have those posters talking about distancing and mask wearing. They're talking about revamping them a little and starting to really celebrate what we do here in our community and what our cultural norms as Tompkins County is. And so you'll see some of that messaging coming out in the next few weeks. And so I think that concludes everything I have for right now. I'll stop my share and turn it over. I don't know, Jennifer, if I want to turn it back to you. I don't know the panel order. So.
That's okay. Yep. Turn it back to me. Just a quick reminder that we are taking questions in the chat. We may ask a question immediately after someone stops, but we may also wait until the end. So it's fine to gather your questions until you hear all the presenters. Feel free to type them in the chat and we'll try to make sure they get addressed along the way. So thanks for all that, Amie. Appreciate it. Great presentation. Next, I would like to invite Rob Lawlis, who is the CEO of Cayuga Health Partners and VP of Network Operations for Cayuga Medical Center, and Dr. David Evelyn, Vice President for Medical Affairs and CMO for Cayuga Medical Center, to share their perspective, both as our key healthcare provider in the community. They've in many ways been leading and helping lead our community's response to the pandemic. I will just say I've had the opportunity twice now to tour the actual clinic up at the mall, the vaccination clinic, and also their testing facilities, and just so impressed with their team and everything that they've set up there, and really appreciate the tremendous amount of resources that they have had to dedicate to all this on behalf of our community. So I'm going to turn it over to you, gentlemen, and use your time to share the information that is most critical for our stakeholders here today.
Sure. So I'll start us off since my name came first in the order. I had the privilege of going between Amie and Dr. Evelyn. Amie, who covered in such great detail the actual process and logistics with respect to registration, which is people's biggest question. And then David is going to talk about more of the clinical side and some of the considerations for the vaccine and common questions that we're getting. So that leaves me with this little piece in the middle just to say something about the logistics and be able to help answer questions as they come up. So as Amie highlighted, I think one of the really important things for the community to know and continue to appreciate is just how lucky we've been with respect to vaccine allocation, testing capacity, et cetera. And a really significant part of this has been the level of partnership between the county, organizations in the community, and the health system that really started right at the very beginning of COVID. And when we started looking at vaccine allocations and hearing what other counties were getting, we've been consistently doing significantly more than any other county as a county or a health system. And that's been because we've been working so closely together. And so really, any of these questions, any of the things that I'm going to have to say about it, Amie could well have answered as well, because the partnership has been so close. Something I do want to highlight about the operations, and I think that is important for everybody to grasp as they're thinking about going and encouraging people to go. This is an extremely complex and large-scale process. So when we're talking about vaccinating over 1,000 people a day, the workforce that's required to do that is in excess of 50 individuals. And when you're talking about 1,000 people a day, depending on the time interval we're doing it over, the target we're trying to hit is moving people through sometimes every 20 seconds. And so you can imagine when there are things that don't go quite as planned, or when there's an issue that's specific to a patient, you can really quickly get a line. And so lots of things have been done to account for indoor queuing spaces and social distancing. And we feel really, really good about the process overall. But it's also important for you and the public at large to understand, again, the complexity and scale of this, and to be considerate and accommodating. So the accommodating is, if you yourself are getting vaccinated and experience a wait time, be prepared for that. And the considerate piece is the appointment times do mean something. And as employers, you guys being flexible with your workforce and accommodating of the times that they're scheduled to get vaccines is a really important part of us being able to continue to vaccinate in the rate that we are in the community. I want to highlight that I think today we're passing 23,000 is the total number of vaccines administered primarily through that site. So again, we're doing really an amazing job as a community. And I think again, I'd really credit the partnership with the accomplishment there. When we get to questions, I'll be prepared to talk more about logistics and other things, but maybe David, with that, I'll pass it to you to tell us more about the COVID vaccines.
Sure. So I'm going to share. Can everyone see that? Yes. So vaccination programs, particularly one like this, of this size, it's all about logistics. The medical piece is really a very small piece, other than the development of the vaccine. But it really is all about how you move people through that line and account for all the things that can happen to people. So first, I thought I would talk about who's eligible. And people need to understand that this eligibility criteria, they change weekly. So as of today, individuals who are 60 and older, individuals who are 16 years to 60 and have certain pre-existing conditions are eligible. In addition to that, the governor has said homeless people, prisoners, people who are under the authority of OPWDDs, that's the organization, that the state organization that cares for people with developmental disabilities, certain Office of Mental Health facilities, people who live in congregate living situations, and then also many, many essential workers, and that includes everything from healthcare workers, restaurant workers now, grocery workers, transportation workers, first responders, police, fire, college instructors, public health workers. I mean, the list goes on. And every few weeks, another group gets added to that list. But the more important question is, why should I get vaccinated? I mean, if everyone else gets vaccinated, why do I need to bother, right? Because I'm protected. Well, not exactly. Remember, this is a pandemic, so that means it's very, very widespread. This is a disease to which no one has ever had before, so no one has any immunity. This is not like a resurgence of measles, but you got your measles shot 20 years ago, or you had measles as a kid or something like that. So this is a very different situation for us. So by getting the vaccine, the first thing you do is you protect yourself. You don't get sick. And because you don't get sick, you're not going to pass it on to someone else. Also, the vaccines, they're not 100% effective, but they're pretty darn good. And what they're pretty darn good at is reducing the severity of the disease. So people who have gotten vaccinated in the original studies, none of them died. Very few of them were hospitalized. Very few of them had severe disease. Some of them did get mild to moderate disease, but it was small numbers. Reduces hospitalizations. And because it reduces hospitalizations, it saves hospital beds. And when you have some other problem, like you have a heart attack, or you have a stroke, or you're in a car accident, there's a place for you to go, as opposed to your ambulance is standing outside waiting for a bed to open up. And as I said before, it really reduces deaths. The second thing, it protects other people. So it protects other people from getting an inadvertent exposure to you who might have COVID if you didn't get it. It reduces quarantines, right? Aren't we all going crazy with the number of people on our workforce that have to be out for 10 days or 14 days, depending on the situation, because someone in their family has COVID disease, yet they're feeling perfectly fine? As I said before, it protects other people, not just our family, but protects other people, people that we work with, other employees. And it really reduces that transmission of this disease. Now we know that this disease, unlike other things like maybe measles, people can get very, very mild cases. But if they have that mild case, they may go to work. They may not feel any symptoms at all. And then they're giving that disease to other people. So the vaccines prevent that from happening. The third reason, this protects our community. The more vaccinations we have, the less absences you have in your employment, the fewer cases we have. You have absences from quarantine and from being ill. Because we have fewer cases, there's less chance for the vaccine, for the virus to evolve and create variants. And that's a problem that we're starting to see right now. We have better outcomes. That means that our vaccines are better because there's fewer variants around. And then the ultimate goal is we want to not only protect people's health, but we want to open up our society. And this will allow us to open up our society. If only 20%, if we stop vaccination today and only 20% of the population got vaccinated, this disease would continue to ravage us for years and years and years. And there's nothing to say that this disease isn't going to be around with us for years and years. This is probably going to become like the flu, where every year a slightly different variant or strain is going to be going around, and we may need to get boosters for that. We hope that we can create boosters that will protect you from multivariants, but that's something that they're working on now. We'll have to see. So really, that's kind of the end of my talk. I will add that there are 3 vaccines that are licensed in the United States: the Moderna vaccine, the Pfizer vaccine. Now, those are both messenger RNA vaccines, a new kind of vaccine for us. They require 2 vaccinations, 2 immunizations. Depending on the vaccine, there's a time period that they have to be separated by, either 21 days for Pfizer or 28 days roughly for the Moderna. And the new vaccine that was just licensed in the United States, the Johnson & Johnson vaccine, that is a different kind of vaccine. It's based on the model of previous vaccines that we use for other things. And that one is a 1-dose only vaccine. So many people are preferring that. And in fact, I was on a conference call with other hospital leaders today, and they were talking about, as Amie said, people vaccine shopping. What vaccine are you giving today? Oh, that's not the one I want. And then walking away from their appointment. So people ask me all the time, what's the best vaccine to get? And I say, the first one that you can get, that's the best vaccine to get for you. So that's the end of my little segment, and I'll turn it back over to Jennifer, I guess you.
Yes, thank you. So I have a brief question as it relates to some of what you just shared. Under the eligibility set, and again, I know we don't want to necessarily encourage vaccine shopping, but so the 16 and over only applies, like the ages 16 to 18 only applies to the Pfizer vaccine, if I still understand that correctly, right?
That's correct.
So if I am in that age group, or if I employ people in that age group and I'm trying to encourage them to become vaccinated, how would they make sure that they are getting an appointment in the correct place with access to a Pfizer vaccine?
So it's not just people who are 16, but they have to have one of those pre-existing medical conditions as well.
Yep.
So that's a little bit of a problem. What was initially happening here was that the Pfizer vaccine seemed to be going to the large state mass sites, and the Moderna seemed to be coming to the counties and to the hospitals. So it was easy a few weeks ago to say, go to the state site because that's probably where you're going to get Pfizer. When you sign up, you need to tell them your age, and they'll make sure that they put you on a Pfizer day or
Okay.
a Pfizer line. Now with the Johnson & Johnson, though the state hasn't given out any plan, we're hearing that most of the large mass sites are getting the Johnson & Johnson. So I think we're going to have to be a little bit more careful about how we direct those 16 and up individuals. And I know we've been talking with the health department about how do we make sure that there's a pipeline for those individuals when we get Pfizer vaccine. Now, mostly we're getting Moderna, but when we get Pfizer vaccine, I think we want to make sure that we save some vaccine or save some appointments for that group of people.
Well, and I know it may be unlikely that that age group is going to have as many of the health conditions, but they are, I think, in a lot of essential worker roles, particularly sort of the grocery store. As I think about, that grocery store employment opportunity, for example. So that's why I wanted to ask that question. I do have some more questions I'm jotting down, but I'm going to save them until later. Thank you, David and Rob. Now we are going to move to Jordan Charnetsky, who is with Levine, Golden, and Thompson. And I asked Jordan to share more about specifically, rules and regulations at the state and federal level that you may want to be aware of, or be aware are proposals that could be coming down the pipeline as well. So Jordan, why don't we move over to you? And thanks again for being here.
Yeah, thanks for inviting me to be here. Can everyone hear me okay? I will share my screen now. Hopefully I figure out how. Slideshow showing up okay for everybody? Okay. Thanks for the introduction. As Jennifer said, I'm an attorney here at Levine, Golden, and Thompson. I'm based out of our Vessel office, but we do have a office in Ithaca, downtown Ithaca. And Jennifer pretty much said it as well as anybody could, that my portion of this is the general theme is really be careful. There's potential liability issues all over the place, both federal and state level, for employers mandating vaccination of their employees. So bottom line is be careful. If you have any hesitancy as to if what you're doing is okay or not, reach out to us, contact your attorney. Definitely isn't something that you want to just go alone and hope you're doing it right. Little bit of background. So mandatory vaccination policies historically, for the flu specifically, have existed in the healthcare field, and courts in New York have generally upheld these policies so long as the employers are aware and are providing medical and religious exemptions under the American with Disabilities Act, which is the major potential issue, one of the major potential issues here. To date, the EEOC published guidance back in December, specifically for vaccination in the workplace. They're really the only agency that has published thorough guidance at this point. There's been nothing out of New York. It's still too soon for New York courts to have really dealt with any issues with regards to vaccination in the workplace, specifically for COVID-19. So really EEOC, which is the Equal Employment Opportunity Commission, for those that aren't aware, is the leading guidance. So that's most of what I'll be covering today. So there's a few different categories of law that the EEOC covers in their guidance. The first one is the American with Disabilities Act, the ADA. So the EEOC's guidance generally implies that vaccination may be required by an employer, subject to certain exemptions. Their guidance doesn't explicitly say an employer can require their employees to be vaccinated. But what it does say throughout the guidance is the direct language is if an employer does mandate a COVID-19 vaccine. So it kind of implies that an employer could mandate a vaccine if they wanted to, but again, it doesn't come right out and say the employer can mandate. So the ADA generally prohibits medical examinations and disability-related inquiries by employers in the workplace. With medical examinations, there's kind of a distinction for both of those actually. If the vaccination is occurring at the job site, either by the employer or by a third party contracted by the employer, or off the job site. Under the ADA, you can kind of get around the two major issues by if you determine to mandate vaccination by mandating it to be done by an outside third party off the job site. So what the ADA guidance, or sorry, what the EOC guidance says as far as medical examinations is that the administration of the vaccine in and of itself is not considered a medical examination. So you can kind of, that really isn't an issue here. The big issue is if the vaccine is being provided at the workplace. The CDC has suggests that there's these pre-screening questions for the vaccine, and these pre-screening questions could be considered a disability-related inquiry, which is prohibited by the Americans with Disabilities Act. These pre-screening questions can be about allergies, pregnancy, stuff like that, and they can implicate this disability-related inquiry portion of the ADA. So the exceptions to kind of get around these issues is if the vaccine is offered through the workplace, but it's voluntary, if the employee has a choice whether or not to disclose this information about potential disabilities through the pre-screening questions, that kind of gets around the ADA issues. And the best way to get around them is if you require proof of vaccine outside of the workplace, so through a third party site, that kind of avoids these two issues at least. Another portion of the EEOC guidance is ADA and Title VII. So there's two kind of potential issues under both of these. It's either if an employee requests or says that they can't be vaccinated either due to a religious belief or due to a disability. So religious belief, if you are mandating or suggesting an employee to be vaccinated and the employee comes to you and says they have and the keywords are a sincerely held religious belief that prevents vaccination, the employer has to provide some type of reasonable accommodation to the employee if possible. And this reasonable accommodation has to not cause an undue hardship on the employer. There's two different definitions for undue hardship, depending on if the employee is asserting a religious exemption or a disability exemption. The threshold for undue hardship is lower for the religious exemption. It's a very, very fact-specific scenario. So your best bet is if you're not sure of anything, contact your attorney. Under both of the exemptions, there is the reasonable accommodation concept. So you have to work with employees if they say they can't get the vaccine because of their religious belief or because of the disability. You have to work with them, sit down with them, see how you can work with them to accommodate their beliefs or their disability. It could be allowing them to work from home, providing a separated job site where they can do the job without risking other employees' health by being not vaccinated. And then if an employee can't provide a reasonable accommodation that goes to that undue hardship topic, it doesn't mean that you can't, or it doesn't mean that you can just terminate the employee because they're refusing to get vaccinated. You have to go through the interactive process under the American with Disabilities Act and figure out how you can work with the employee to make, you know, the job site and the employee safe and make the employment relationship successful on both sides. Another potential issue that the EEOC guidance touches on, not as big of an issue as the ADA, is GINA, Genetic Information and Non-Discrimination Act. What GINA does is generally prohibits employers from taking job-related actions based on an employee's genetic information. So the first part of the guidance is whether GINA is implicated by administration of the vaccine itself. And the answer to that is no. So you're okay there. And then is GINA implicated by pre-vaccine screening questions that I previously mentioned? And the answer to that is maybe. It depends on the content of the questions, so you need to be careful there. And again, similar to the ADA, the way to avoid the issues under GINA is by requesting proof of vaccination instead of actually administering the vaccine at the job site. As Amie mentioned, another potential issue is the FDA's emergency use authorization. This is also covered by the EEOC guidance, which I have a link to at the end of my presentation. If anybody has, wants to look at more information, find out, more details about what I've been talking about. So you have to be aware with the EUA, it says that the FDA has to ensure that individuals have the choice whether or not to take the vaccine. And the EEOC's kind of workaround for this is they say that there's paperwork that is provided to people before getting the vaccine that does say that it is their choice. This part of the guidance doesn't really say whether or not an employer can or can't mandate a vaccine. So it's not really addressed under this portion. And then as far as specific New York State guidance, there's nothing, at least to my knowledge, that's been released. We've been staying on top of everything that's been coming out this past year, really. And as of now, there's nothing directly from New York as far as mandating vaccines in the workplace. So there is a proposed vaccine leave through New York. It hasn't been signed into law yet. And it'll come after, so earlier in the year, there was a new portion of the labor law for New York sick and safe leave. And this new leave, if it's signed into law, is planned to come in directly after that. And what it provides is paid leave to employees for a sufficient period of time, which they define as not exceeding 4 hours per vaccine. And it prohibits discrimination or retaliation by employers for use of the leave. So if an employee chooses to, if this gets signed into law, if an employee chooses to use the leave to get vaccinated, you can't fire them, change their work description, or change their hours due to asserting their rights under this leave. And as of now, it'll apply to private and public employees and employers. So you as the employer really have 4 different options as of now. The first one is take no action. Don't really address vaccination issues with employees. The second option is encourage vaccination, but not say you have to get vaccinated to come to work. If permitted, another option is mandate proof of the vaccine, which could avoid, as I discussed, the ADA and the GINA issues. And the fourth option, which is the most drastic and the most likely to lead to issues, is mandate the vaccination administration by the employer or by a contractor through the employer at the work site. And here are 2 different resources. The EEOC guidance goes into a ton of detail about all these potential issues, and I provided a link to the proposed bill if anybody is interested in looking at that. Thank you.
Thank you so much, Jordan. If you have the ability to paste those links in the chat, I think some folks
Sure.
might appreciate that as well. Thanks for that. I do think one thing that we would like to suggest just as a best practice, and again, as a way that employers can help encourage vaccination is not to wait until New York State mandates you to provide paid sick time or paid time off to get vaccinated. And I would just suggest that, you know, the 4-hour time frame may not actually be enough for someone to accomplish 2 vaccination trips. And just for a couple of reasons. So if you were assuming that they could absolutely get vaccinated within the county that they lived in or within the county that they worked in, and to do so within, you know, an hour or 2, then that might be a sufficient amount of time. But for example, it would be rather difficult for many folks to drive from their home or their workplace to one of the regional vaccine sites in Syracuse or Binghamton or even Utica. They're all within a reasonable drive distance of here. I'm not suggesting that people go driving all around the state, although I've heard a lot of interesting stories. Lots of people going to Potsdam in the last couple months, probably more people than they've seen in 2 or 3 years. But you know, that you may want to think about a bank of 8 hours, for example, or some, you know, or we're just saying however long it takes you or whatever time you will need to get vaccinated, it'll be paid time off. So that would just be, that's how we're handling it. You know, certainly you all have access to probably some more HR experts that could give you official advice on that. But, you know, if you wish to support employees feeling empowered to make their appointments when they're available to them at their soonest opportunity, you know, figuring out how to support that with paid time off, and you may need to support that with scheduling support and coverage and some other things internally in terms of how your workforce manages those absences. But those are some things that we have been doing here at the chamber. So. So Ashley, that is a really good question. So Ashley asked, and I don't know if anyone has the answer to this, can you get credit for vaccine related to paid leave as sick leave? Does anyone happen to know the answer to that? I will make note of that question and I will try to get you an answer, Ashley. Yep. Great. Okay, we have some more questions coming in, which I'm going to make note of for now, and we'll continue to take questions in. And I'll apologize for the train sounds. It's nice to be in the office because we actually get to hear and see trains, and we get to see the lake and hear the birds, but apologies for the extra noise. Now I do want to turn it over to Patricia Fernandez de Castro, who is the president of the Latino Civic Association of Tompkins County. Patricia is a member of the Southern Tier Vaccine Task Force. She's also on the equity subcommittee and or task force, both at the regional level and at the state level. And I just think it's an important component for folks to understand all of the efforts that are going into trying to support access, particularly to hard to reach populations, both at the local and regional level and also at the state level. So can you share some of that perspective with us, Patricia? Thanks for being here. Oh.
Yes, of course. If I unmute myself, it will be a lot better. Thank you very much for having me. Thank you very much for the interest. And I will share my screen. I will focus first. I will talk a little bit about, for each of the 2 task forces, I will talk a little bit about the structure, the composition, and then about their work. So let me share my screen. Oh, I should start by, oh, it's the other way around. Okay, share. Now I go here. Okay, I think you should be able to see now. Okay, so I am going to start off with the New York State Vaccine Equity Task Force. When it was originally formed, it included almost 300 individuals, of which in the end only about 100 actively attended. It had about 170 community, nonprofit, and education organizations, and this is my classification of the organizations. They were faith-based, ethnic, age or gender centered, issue-centered. There were also a few educational organizations, and there were a number of offices of the state government and some of New York State government also represented. It was the Vaccine Equity Task Force is very much, in terms of composition at least, it's much more focused on downstate than upstate. And I will show you the numbers for upstate. It also overrepresented certain groups, certain religious denominations over others. And I think this reflected the speed at which this had to be put together. As it has been said several times in the course of of the vaccination effort, we're building the plane and flying it at the same time. So there was a overrepresentation of some religious groups, of some ethnic groups. Some ethnic groups were particularly underrepresented, and these were particularly Native Americans. The urban groups were also way overrepresented, and downstate. So as you see, this is the representation for downstate. Of the 170 organizations that were involved, 62 individuals actually, of the 300 individuals that were originally invited, 62 were from upstate organizations. And of those, many of them came from the larger urban areas in upstate. So there was that was a little bit of a problem. So those of us who are present have been very vocal in trying to bring upstate concerns and making sure that the task force understands the differences in how things work in upstate relative and the resources we have and how people live, and their things are simply different in upstate than they are in the city or the suburban counties right around New York City. And one thing I would like to note here is that some counties were completely unrepresented. For example, two of the largest agricultural counties in the state, Wayne and Cayuga, were not represented at all. So that was somewhat discouraging to notice. The task force is divided into three large subcommittees: clinical, education, and community outreach and messaging. Towards the end, the leadership realized that the work of education and community and outreach and messaging, really there were a lot of intersections. And towards the last part of February, we were working together, and there was a lot more communication between these two groups. The clinical subcommittee is much more technical, focused on really very matters that have to do with medicine and much more logistical. So they keep on their own, but the other two subcommittees, there's a lot more cross communication. The discussion questions that were presented to us at the very beginning were these, and they reflect the fact that the task force was formed to address the inequity in both not just in access to the vaccine, but in the way the disease was hitting different populations. The very large numbers of Black, African American, and Latinos who were getting sick and dying. The fact that these populations are much more vulnerable in terms of their access to healthcare, their access to the vaccine, their access to information. So the task force was formed to address all these things. these were some of the products we were intended to eventually come up with. FAQs, all kinds of basically information and education material. 2 weeks ago, we presented our recommendations to the governor, organized across 4 pillars. Empower community leaders, build infrastructure that provides genuine communication, deploy community-driven public outreach, and eliminate technology and language barriers. And I'm just going to very briefly show you sort of some of the main axes of these recommendations. Engaging community leaders, doctors, clinicians. Some of them have been already, some of our recommendations have already actually been implemented, such as the pop-up sites, the mass vaccination sites. We very much advocated for ensuring data transparency and clear guidelines, which respond to the fact that a lot of the vaccine hesitancy that we observe, especially in populations that mistrust the healthcare industry, have to do with misinformation, confusion, and sometimes different things coming from different offices, or lack of sufficient transparency. So in trying to address hesitancy, that was one of the things that we thought was the most important. Regarding infrastructure, these are some of the recommendations. Very importantly, prioritize communication between and across government and local partners, which is in some ways logistically very important, and also addresses some of the places where that confusion originates and reinforces the hesitancy. And of course, facilitate everything, do everything possible so that we can have make the vaccine as accessible to everyone as possible. The last 2 pillars, community-driven public outreach and language and technology barriers. The basic idea is to formulate PR and community engagement programs that include things like the fireside chats, transparency regarding access to the vaccine of people, regardless of their immigration status, the use of census infrastructure for education, engaging the unions and employers, such as you are doing right here, and also being very transparent about cost to the public and issues with the supply, which to some extent are what has been determining the difficulties that people have been having access to the vaccine. And language and technology barriers, we all thought were really very important, and sorry for that typo there. The focus was on two of the most important recommendations was creating online mechanisms for people to get information and register to get an appointment, and to provide language services both in the online and call centers and also at the vaccination sites. There was some discussion about whether or not to use robocalls to try to get people to register, and there was a very robust discussion in that regard, with a number of us advocating not to use them because of the potential for scammers to precisely target the most vulnerable populations. So that is about the state task force. Now going into the Southern Tier Regional Advisory Task Force, it is being spearheaded by UHS in Binghamton. And as you can see, it is a lot more representative of all the counties that are part of the Southern Tier, unlike the state task force, which had some issues with the representation. So the structure is to some extent mirrors the state task force. There is the full task force that meets more often than the state task force does and did. The subcommittees are education and outreach and the pod coordination. There's a greater emphasis on planning and logistics, partnerships across the region, hub and partnerships between the hub and local governments and nonprofits. One thing that I've observed is that there is a lot of emphasis on thinking outside the box, flexibility, proactive problem solving, identifying best practices, addressing the issue of mobility of transportation, which is one of the key barriers to vaccination, especially for the most vulnerable populations. And the regional website, which is really very, very informative and tries to really present a very comprehensive view of the whole of resources and vaccination effort across the entire region. So here I have some of the most recent numbers that were presented to us today, and Jennifer saw them. This is sort of where we are in terms of vaccination. And as Jennifer was saying, we're at around 20%. 1 out of every 5 persons in the southern tier has been vaccinated. And this is geographically, as you can see, some of the counties have vaccinated larger numbers than others, and are approaching 24%, Tompkins being one of them. This is the website, which it really has done, I think, a great job of bringing together information from the entire region. It is very helpful, and apparently it's getting a lot of traffic. So this is one part of the website. The second part of the website, it has all this information, the town hall meetings in the different parts of the region. It's very, very well done, I think. I should also add that one thing that in particular I have been focusing on, both in the state and in the regional task force, is the questions to do with farm workers. Farm workers, as you know, are essential, and they do in-person work. They live in congregate housing, therefore are more vulnerable to contagion, to catching the COVID, and the importance and strategic nature of their production. If the state is the second largest producer of dairy, that means there isn't a lot of other sources of dairy to feed the state, and that very important. Dairy being what it is, it's particularly important for the children of the state. So for all those reasons, I have been advocating for greater attention to providing vaccines to farm workers. And one of the recommendations that was made to the governor was to include farm workers among the essential workers receiving vaccines. That has not yet happened. There is a farm worker coalition that has worked with the task force, and also in particular with Julissa Gutierrez, the chief diversity officer, who is heading the task force, the state task force. Among the organizations in that coalition, there's the Workers' Justice Center and all of these other organizations, including the Latino Civic Association. And here, this is I think it is one of my last slides, are some of the reasons that make farm workers so particularly challenging. There's day and night shifts, the length of their work days, the start and times, their isolation in terms of their actual location, and also lack of information, the lack of transportation, a lot of hesitancy, their language needs, the lack of familiarity with local DOH websites and other websites that are not in Spanish, the lack of time to wait on the phone when using a call center, and that there is yet no paid time off for vaccination and paid time off for their secondary effects. And another thing that is affects everyone, but I think the most, and it was discussed in both the state and the regional task forces, is the fact that for a lot of the vulnerable populations, their means of communication and the means of getting information are not the mass public media that many of us use, certain websites, newspapers, and things of that sort. But they rely a lot more on things like WhatsApp and Facebook to get their information from their own networks, which of course means they are also more vulnerable to misinformation, which feeds into the hesitancy loop. So that is one thing that we discussed especially in the state task force, was the need to have media that is tailored to use Facebook and WhatsApp to get information to them, as opposed to a website, and to have all the websites that are being used, all the DOH websites, the hospital websites, all the vaccination related websites, to be available in multiple languages, especially perhaps Spanish, but also, for Tompkins County, a lot of Asian languages, as 10% of our population is Asian, 5% of our population is Hispanic. So those would be the languages that are really critical for every single communication to be used. Yeah, I think that would be sort of, and the other thing would be, like, for example, if we're going to have things like the fireside chats or the office hours, they need also to take into consideration these particular times at which people are at work. The more the essential workers, the restaurant workers, the grocery store workers, the farm workers, they're not out at 5 p.m. They can't take an hour off at noon to attend a talk. For the reimagining policing effort, the county had focus groups, and we did them at 7, 8, 9 o'clock at night. Some of them we did them in person, because that's the time when the target audience is available. So with that, I finish my presentation. Thank you very much, and if there are any questions, I'd be happy to answer them.
Thank you so much for that. Really appreciate that overview. I think it's really important information to be sharing. So thanks, Patricia. There are a few groups of essential workers that we have been concerned have still not been really clearly listed as eligible. I will say, if any of you are, one thing I did want to just briefly touch on is, eligibility documentation. So when you go through to register, and again, the Tompkins County Registry is different than if you try to go register in one of the state facilities. But there's the process of registering and declaring that you do qualify or you are eligible. And that's different from actually how to document it. And it's been a little bit difficult to get clarity on what's acceptable documentation. It has come up a few times just in, interactions people have asked. And certainly a note from a doctor, if it is a comorbidity circumstance, is, I think, helpful. Or even a report from your last visit with your doctor that documents that condition may be sufficient. The county does have, I'll just say, there's a self-certification form of these conditions that you can fill out, just stating that you do have one of these conditions. The county does have one of those forms on their website. And it's very possible, I think, that folks can print that form out, fill it out, self-certify, and bring that with them to a state vaccination site. I've heard some stories, and I'm just sharing this is anecdotal, just stories of people's experiences being different depending on the person that they might encounter and how much documentation that person might be expecting. So I just think being as prepared as possible and having, the self-certification, and if there's any additional backup documentation, is good. From an employer perspective, so you know, if you look at the eligibility list right now and you understand the workforce that we have in Tompkins County, a really pretty significant portion of our population is actually eligible. When you look at who actually works here, how many people are educators, P to 12, how many people might work in restaurants, might be also hotel workers, may be in some of these frontline positions. And now with the additional eligibilities that have just come out in the last week, we have a lot of folks here that should be able to access vaccines. And then if you look at the 60 and up population, that's another whole, you know, tranche of individuals. So obviously, you know, the goal today was to encourage you all supporting your workforce in scheduling and receiving those vaccines when they're eligible. To the extent that you can be helping share information on a somewhat regular basis with your workforce about who's eligible. Again, there's a lot of places this information is being shared. The county's doing an incredible job, but sharing that from the employer to your workforce is also another way to make sure that people are getting the information and understanding when it's their turn, when they might be able to register and go get a vaccine. I did just, a final note about employers and documentation. What I understand is that someone could bring a pay stub with them. I don't know that in all cases it's going to be very clear. I know some people have contractors, for instance, that might not directly be paid by the employer in question or the business in question, but may technically be eligible. And so in some cases, we have suggested to employers just providing something on letterhead that indicates that that person works at that business and is a public facing employee would be an extra piece of documentation that might help ensure that they don't have any barriers when they do go to their appointment. So anyway, those were just a couple of other notes. Again, just some pieces for employers to have available to them. Does anyone else have any final questions or any final comments from any of our panelists today?
Jennifer, just one comment that came in. When you're eligible, please sign up and get the vaccine. We have heard of people who want to wait because they want to make sure, you know, someone else can get it before them. If you're eligible and you can find an appointment, get the vaccine and encourage your workforce to do that. There's going to be enough vaccine for everyone. And so we just need to continue, and more eligibility opens up as we start to close off these groups. So if a lot of people in one group are kind of waiting to see or waiting because they haven't felt that another group has already been satisfied with how much vaccine they have, it delays the whole process. And so I just got a question in the chat about that. And please just encourage people, if you're eligible, get it. And by you getting it, you are helping that other person that you're trying not to help, because the more we can get to take the vaccine, it's the better for all of us, as Dr. Evelyn pointed out.
Thank you for that. I really do appreciate that. And I, you know, again, things have changed so drastically in the last 3 weeks, even compared to, you know, 8 weeks ago in terms of supply. And I think the other piece to remember is not everyone can travel to one of these other state facilities. I think just understanding this, a lot of the supplies going to the state facilities, being directed by the state to those facilities. There's also supply being distributed through numerous avenues at the local level. I think for some folks that may be holding back because they're afraid they're taking an opportunity away from someone, it's also just helpful to understand that not everyone can travel, not everyone has the time or the ability to get to one of those state facilities, and that they should not feel bad for doing so. So I do appreciate you sharing that, Amie. Absolutely. Because we do want the next level of people, we want the next tranche of eligible people to come sooner than later. So that's only going to happen if we increase the percentage of the eligible population right now that's actually fully vaccinated. So thank you. Thank you all for being here. Thank you to the panelists. Again, this is really important information. I appreciate you taking time out of your day to share this. The chamber will be making this available after the fact, again, on our YouTube channel, but we'll also be sharing it through our social media and our newsletter. If you have any questions you didn't get a chance to ask today, you can feel free to reach out to myself or David. And I'm sure you can actually find most of our panelists as well if you have a very direct question that you'd prefer that they answer. So that's all I have. And back to you, David, if you have any final thoughts.
Yeah, I just want to again thank our panelists. The information that you all have been sharing through this entire pandemic has been invaluable. So we are all very appreciative for all the hard work that you've been doing behind the scenes and on the front lines. A huge thank you again to our L.E.A.R.N series sponsor, Tompkins Trust Company, for their continued support for making this series happen. And I would just say, if you have any further questions, please feel free to reach out to the chamber. We can put you in contact with one of these fine individuals and try as best as we can to get all of your questions answered. So thank you all very much for being here. Be sure to check out the Chamber's event page for any upcoming events that we do have. Our 2 diversity, equity, and inclusion workshops are right around the corner on the 17th and 31st of this month. So stay tuned and hope to see many of you there. All right, have a great rest of your day. Be safe, have a great weekend, and we will be in touch soon. All right, bye everyone.